और मेरा संगीत.com के आज के चैट इन चाय की पॉडकास्ट पर आपके रूबरू रहेंगे जाने माने यूनाइटेड स्टेट्स के प्रैक्टिसिंग डॉक्टर विकास भतारा। आज हम उनसे बहुत सारी जानकारी लेने वाले हैं अबाउट
Kanwal, today we'll talk about acute illness in diabetic patient.
Dr. Bhatara, now a little bit about the topic here. Acute illness in diabetic patients. How to manage sick days in diabetic patients.
That means when you are a diabetic patient, whether you're type 1, type 2, or you are on only oral diabetes medication, or you're taking insulin injections, or you're taking newer GLP-1 injections, how to manage an acute sickness. It's a very important topic and very confusion among people how to manage sick days. So what we're going to talk about today is going to be a general rule of thumb, but nothing going to substitute the advice of your doctor or going to the emergency room when it's needed. So patient always ask me how to manage my sick days during the diabetes or what to do with my diabetic medications. We need to realize that stress from the acute illness can cause hyperglycemia. That means stress itself from any acute illness can give you high blood glucose. And on top of that, you're taking less food intake due to your poor appetite or vomiting that can cause hypoglycemia. That means low blood sugar. So during the acute illness, your viral fever, stomach ache, stomach flu, that kind of illness we're talking about. So what you do, I would emphasize, is plenty of fluid to prevent dehydration, because the higher the sugar level is, the more urine you make, the more time you pee. And small serving of sweetened beverages, that I would take a lot of fluid and some kind of like juice. That's a sweetened beverage I would call, if the patient cannot eat. So taking a lot of fluid and small serving of juices is good enough when you are acutely sick.
और चलिए अब मैं आपको कुछ खास बता देती हूँ, स्पेशली हमारे वो लिसनर्स जो बॉस्टन में रहते हैं। अब आपके बिल्कुल नजदीक यानी बॉस्टन में ही खुल चुका है तनिष्क। सो जब तक आप कर रहे हैं एक विजिट को प्लान, पहुंच सकते हैं आप तनिष्क.com पर ज्यादा जानकारी के लिए। और शो में अब हम बढ़ते हैं जरा आगे। आपके रूबरू इस वक्त हैं डॉक्टर विकास भतारा, जाने माने डॉक्टर हैं, यूनाइटेड स्टेट्स में बहुत सालों से प्रैक्टिस कर रहे हैं। आज हम बातें उनसे कर रहे हैं अबाउट acute illness in diabetic patients, how to manage sick days in diabetic patients. So Dr. Bhatara, what would you like to say more on the topic here? Is it the same for all diabetic patients, the care that we have to give them, or is it going to be different in different type of diabetic patients?
Now we have to take these people in different categories. The people who are using only oral medications to manage their diabetes, like metformin, sulfonylureas, etc., or non-insulin injections like GLP-1, Manjaro, Wegovy, these kind of things that people inject. I would advise not to stop these medications when you're sick, or even if you cannot eat. You take your medications. I will not stop them. But if you are not eating at all and you are at the risk of hypoglycemia, I would say you can hold your sulfonylureas, your ripaglanides, and nitiglanides. These you have to look in your salt of your medication what you're giving. Okay. You can hold your SGLT2 inhibitors or metformin with vomiting or severe diarrhea. In the initial phase of illness, I will never hold them, but when it's becoming really severe, you're not eating at all, you're just fasting, I would advise holding them, because taking them could increase the risk of ketoacidosis or kidney injuries with SGLT2 inhibitors, and a layer kind of side effect called lactic acidosis with metformin.
Acute illness in diabetic patients. How to manage sick days in diabetic patients. और आमतौर पे हमने ये वर्ड काफी लूजली सुना है डायबिटीज के बारे में कि एक क्रॉनिक हेल्थ कंडीशन है और ये इफेक्ट करती है कि कैसे हम अपने फूड को एनर्जी में तब्दील करें। आमतौर पे हम डायबिटीज के बारे जानते हैं, सुनते हैं, टाइप 1, टाइप 2 और जेस्टेशनल डायबिटीज के बारे, लेकिन ये आम सा नॉलेज होता है और हम वक्त वक्त में यही कोशिशें करते हैं कि हम तमाम से हेल्थ इश्यूज के बारे में आपको जानकारी देते चलें। आपका फीडबैक भी हमारे लिए काफी अहम है और अगर डायबिटीज के बारे में स्पेसिफिकली आप कोई सवाल पूछना चाहते हैं, डॉक्टर भटारा तक पहुंच सकते हैं आप।
I would restart when patient resume eating and drinking. So start these medications when you resume eating and drinking. And I would advise, please call your doctor to seek urgent care or go to an urgent care if the blood glucose is over 300 milligrams per deciliter for 2 tests over several hours in a patient who is usually well managed. Because, maybe a short-term insulin might be needed at that time. And now these are the people who are taking only oral medication and non-insulin injections. Now we're going to talk about people who are taking actual insulin injections. So I would educate the patient not to stop insulin when patients are sick, but explain that doses may be adjusted. So we need to adjust the dose. For example, if the glucose is over 250 milligrams per deciliter, and I would recommend that add about 5 to 20% of the total daily insulin dose to the patient's rapid acting insulin, that's Lispro, based on glucose and intake and ketones. So it is a very, very, knowledgeable. I would not let my grandma change her insulin doses, but help her, to adjust insulin doses when she is sick. On the other hand, if the patient on insulin cannot consume adequate carbs, I would say, okay, lower or maybe skip the bolus dose of your insulin. And if you are on a long-acting insulin like glargine, okay, I would say you can continue your basal dose. So basal dose you can continue because they'll keep you at least some insulin in your system even at the reduced dose. Testing is very much becomes important. That means testing of your glucose when you are sick. I would recommend a frequent blood glucose testing during an acute illness, such as every 2 to 4 hours for patients on insulin, or about 2 to 4 times a day for the patient not on insulin. And also, another advice I would give for the type 1 diabetics, the people who are young and on insulin, to test ketones while sick, especially if the glucose is persistently over 250 milligrams per deciliter. But ketone testing isn't needed for most of the patients with type 2 diabetes, since diabetic ketoacidosis is rare in type 2 but very common in type 1 diabetes. And in the end, yes, emergency room care is important. If the patient has prolonged vomiting, can't have keep his fluids down, and have persistent hyper or hypoglycemia, those people should go to the emergency room. I hope these tips and the rule of thumbs will help our listeners to manage their sick days who are diabetic. Thank you.
So thank you so much, Dr. Bhatara, for taking our time and for being a part of merasangi.com here and letting our listeners know about this very important issue. Stay tuned in with us on your favorite podcasts on merasangeet.com.